Hello, everyone. Welcome to PCE Final Frontier podcast. I am Shivangi, your PCE guide at PCE Final Frontier, helping one student at a time. Visit our website www.pceff.com to enroll in our courses today.
Welcome back to the PC Final Frontier podcast. Today we are diving into a topic that can be quite challenging to grasp, but is essential in our practice. Yes, you guessed it right. We are discussing lymphatic management. Lymphatic treatments, as we all know, are a cornerstone in managing patients with lymphedema, chronic swelling, or after surgeries where lymph nodes have been affected. But understanding the techniques and when to use them can be confusing. Today, I am going to clear that up. So, you are working at a clinic with a patient. The patient reports to you on Monday morning saying that she had a rough weekend. All her left upper extremity, all the way up to her fingers, were swollen and she was in a lot of pain. She had to go to the ER and get some medications to help with the pain. Now, you are working with that patient on her shoulder joint and her neck area. She does have some degenerative joint disease of the neck and the shoulder, but that does not explain the swelling in her whole upper extremity. So, on further assessment, on further questioning, you find out that the patient has a past history of cancer and she underwent surgery for it, which, made complete sense, which means her lymphatic systems are affected. Her lymphatic fluid is not being pulled up to her proximal area, causing swelling in her distal extremities. I stop the treatment for the patient, recommend patient to go see her doctor, see her oncologist, and see if she can get a referral for lymphatic treatment. The patient comes back next week and tells me that yes, we were right. Her oncologist thinks that her lymphatic system is congested and needs the lymphatic fluid to be pushed out. So, a quick talk to the patient before touching her shoulder or neck, before saying that no, it happens, it will go away. I clearly help the patient to make a smart decision. She got the treatment she need. We avoided making it worse. So that brings to our topic of discussion today, lymphatics. So first, let's talk about manual drainage. This technique is often the starting point for lymphatic treatments. The idea here is to manually assist the movement of lymph fluid, which typically means working from proximal to distal. In simple terms, we start by stimulating the areas closer to the heart before moving outwards to the limbs. This helps to open up the pathways for the lymph fluid to flow more effectively. Next is the decongestion. Similar to manual drainage, decongestion focuses on also moving the lymph fluid. However, decongestion works from proximal to distal as well, making sure the pathways are clear before addressing the more distal or far away body segments. It's also about setting the stage for proper fluid movement. Now, let's discuss stroking. So, unlike manual drainage and decongestion, stroking is done from distal to proximal. Now, why? That's the question. The goal here is to push the lymph fluid towards the central circulation. You are essentially giving it a gentle nudge towards your heart. This technique is especially useful after you have done a manual drainage and decongestion, opened up the proximal segments, so stroking helps to push the lymphatic fluid more towards the proximal central circulation. Another key technique is the use of compression bandages. These are also applied from distal to proximal, just like stroking. The compression bandages helps to prevent fluid from pooling in the extremities and promotes an upward flow, ensuring that the lymphatic system continues to function efficiently throughout the day. Finally, we have exercises. These are the only part of the process that return to proximal to distal directions. Exercises help activate muscle pumps, which naturally assist the lymphatic system in moving fluid. It's like giving the lymph system an internal boost to keep things moving along. To recap here, remember, lymphatic management involves a combination of techniques, each with its specific direction and purpose. Whether you're working from proximal to distal with manual drainage and decongestion, or from distal to proximal with stroking and compression bandages, every step is crucial in ensuring an effective lymphatic drainage. I hope this breakdown helps clarify the process for you. Remember, knowing this technique is different, but mastering these techniques will make a huge difference in your patient's outcome. Thanks for tuning in to the PCE Final Frontier podcast today. If you found this episode helpful, please subscribe and share it with your colleagues, and let us know in the comments section what other topics would you like to have a podcast for.
Thank you for joining today. Reach out to us at support@pceff.com for any questions. Follow us on social media on Facebook, Instagram, and YouTube for more content. Have a wonderful week and keep learning.